Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? We're here to explore those questions and get some answers today with my guest Tyler Burke on the Plastic Surgeon Podcast. Hello, my friends. Welcome back, and thanks to our listeners for the amazing feedback. We have had so much fun so far and look forward to more of your insights and suggestions. Please rate and review us on Apple Podcasts to help us get you more amazing content. On the Plastic Surgeon Podcast, we listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand the motivations of why they would risk their life under the knife. I'm Dr. Sajan, and today my guest is Tyler Burke. We're here to talk to you about your journey, how we came to know each other, the procedure you underwent, and how it helped and affected you. How's it going, Tyler?
Pretty good.
Tyler, I appreciate you being here today. And what we're going to do today is we're first going to talk about you, then we'll talk about the procedure we underwent, and then we'll go into how that's impacted your life. That sound good with you?
Mm-hmm.
So, Tyler, you came to me because you were considering having gender affirming surgery. Is that correct?
Yes.
Now, would you mind sharing with us what was your gender assigned at birth?
I was born female.
And then you transitioned. Is that correct?
Yes.
And what did you transition to?
Male.
When did you start that journey?
So I came out to my friends like 6th or 7th grade. So I was like really young. And then I came out to my parents when I was about, what was it? Like 13, 8th grade, beginning of 8th grade.
And how old were you when you decided or when you underwent surgery?
I was 16.
And you're 16 now, correct?
Yes. Yep.
So you are someone who's a minor who underwent gender affirming surgery by me.
Yes.
And that's something so thought-provoking that people often ask about. Many doctors, as you may know, don't do surgeries on minors. However, there are some that do, and I do, because I believe gender-affirming surgery, Tyler, is medically necessary. It's an operation that changes lives, that can help build lives and help people get to their true identity. So tell me, how did you first understand or learn about what it means to be gender non-conforming or transgender?
Well, I think one of my friends came out in like 6th grade, and I was like, you can do that? Like, what? And then before that, I saw like people who transitioned from male to female, but I didn't know you could do it the opposite way. Because there's a lot more representation for male to female than female to male. So I just didn't see that. And then I searched on YouTube like female to male transgender, and then like a couple YouTubers came up, and I was like, oh, this is like a real thing. Like I can do that. Because I was always a tomboy. Like always, since I've been able to dress myself, basically. And like, I just didn't feel right, but yeah.
And your friend that told you about this, when did your friend, where did you have this friend from? Was it from school? Was it family, friends, neighbor?
It was from school.
And your friend transitioned, is that correct?
Yes.
And
not medically, but socially.
And was it private or public school?
Public school.
And when your friend transitioned, Tyler, did they talk about it in school? Did the teacher say what was going on or anything like that?
The teachers, yes, the teachers, all of my teachers, I'm very lucky. I live in a very accepting part of America. So all of my teachers were very nice to him. So,
okay.
Yeah.
So when this person was transitioning, was it during the school year or did they come socially transition?
Yes, he came out mid-school year.
Got it. And did the teacher say this person is transitioning or no one said anything? It just happened?
Yes, the teachers like told people to like respect them, and yeah, the teachers were all really cool about it.
That's awesome. And did your friend start using a different bathroom right away, or how did they handle that?
So he used he didn't use the male restroom, but he also didn't use the female restroom. There's a gender neutral bathroom in the office of the school. So we just went there.
Okay. And when you heard about this, when your teachers announced it, is that what sparked your thought on it?
No, he talked to me about it first, and I was like, I wasn't feeling right already. I just felt so weird, and that was about when like puberty hit, and that was very stressful for me, and I didn't understand why.
How were you feeling weird? Tell us more.
It's so hard to explain. I just felt like gross. I felt like not me. I like didn't feel that bad until puberty started, and then I just like I didn't feel like me.
Were there things that were happening in puberty that made you feel more uncomfortable that you were seeing or feeling?
Yeah, my chest started to like grow, I guess, and I like didn't like that. I hated it.
And did you start binding?
I didn't start binding until like 7th grade.
Okay.
Around.
And
I was binding unhealthily because I didn't have a binder. I used like ACE bandages.
And then in 6th grade was when this happened, correct? Your friend?
Yes.
Okay. So you had a conversation with your friend. And was this person your friend before they transitioned or after?
Yes, before.
Sounds good. And you all just played together or hung out or something like that at school?
Yeah, we hung out. I had a very small friend group.
How did your friend explain to you that your friend was transitioning?
The details are a little bit fuzzy because it was a long time ago. I think he was just like, I want you to call me this because I'm not comfortable with this at all. Like stuff like that.
That makes sense. Mm-hmm. And the things, when you say socially transition, because a lot of people may not know that, and I think it's so amazing that you're sharing this, Tyler, and I know it's really hard, and thank you. Does that mean there were change? Tell us what that means first.
Oh, okay. So socially transitioning is different from medically transitioning because at the time he was in 6th grade, no doctor would like prescribe him hormones. And like, I completely agree with that. Honestly, I don't think you should get hormones that young. In my personal opinion, I don't know. And so he just like started binding and he started, I don't know how to describe it. Sorry. He started binding. He asked people to call him by his preferred name and his preferred pronouns. He didn't go by female. And yeah.
And then you had this conversation. It made you learn that something else was possible.
Mm-hmm.
And then the year went by. You went to 7th grade.
Yeah.
And when did you start feeling that this is something that you identified with?
Definitely like late 6th grade, early 7th grade.
And did you tell your family?
No, I told my family 8th grade. I was really stressed about that. I don't know why. They're completely accepting now, but.
And when you were going through these things, did you do anything more to explore what it means to be transgender?
There's a really great YouTube community for transgender people, which really helped me. It helped me like learn how to like pass and like, yeah, like what clothes to wear to like accentuate like my shoulders and not like my hips or my chest, stuff like that.
And when did you start doing this?
Probably 8th grade.
And was it after you told your parents?
Yeah, after I came out.
So you struggled with it internally for
yes.
Once you learned a year or two, right?
Mm-hmm. I did tell my friends though, so they were yeah.
What did you tell them?
I told them that I was trans and I wanted to go by this name, Tyler.
But no one else knew at your...
No one else knew, no.
What pushed you over the edge in 8th grade to tell your parents?
I just was super dysphoric and I was like, if I don't tell my parents, I'm never going to tell my parents, you know, and I like needed things to change.
Did you ever have thoughts of hurting yourself or changing some of the puberty changes that you were seeing?
No. I did use ACE bandages even though I knew it was unsafe, but I didn't ever hurt myself or have thoughts of hurting myself. I'm very lucky. I know a lot of people, trans people did.
Yeah. I remember during the coronavirus where we were restricted on doing surgeries, I had to cancel, all my gender affirming surgeries. And I had one patient, they attempted suicide. And we had to call the police. They called us and said, I'm going to attempt suicide if you can't do my surgery. And we were restricted by the orders by the state that we couldn't do any surgeries, elective surgeries, when the outbreak was really getting started here. And we had to call the police to go there and protect our patient. Everything went okay, but it really woke me up more and more of how necessary these surgeries
Yeah,
are.
they're very important.
So in 8th grade, you had you came out, if you will, to your family.
Yes.
Tell me how you did that. Did you go to your mom or dad first, or how did that happen?
It's kind of embarrassing. I went to a restaurant with them and I told them, and it was like really awkward. And then I had to like stand outside and just like breathe because I was like so scared. Everything went okay. Everything went good. But I was just like, all the stress was building up beforehand.
And was there something that sort of pushed you over the edge to tell them?
I think it was just my dysphoria. It was getting so bad that I felt like I couldn't even get up in the morning.
Did they have any hints? Did you start changing the way you dressed or anything before that?
Yes, I've always dressed very tomboyish since like the 3rd or 4th grade. I don't really remember when. Do you know when? Yeah, 3rd or 4th grade.
What were there other male, quote unquote, male identifying things that you were involved in before this?
I'm not quite sure what you mean by that.
You know how some people identify, I don't agree with this, but there are certain social norms that some people think are more male versus female, like blue color, more action figures.
Yeah,
stuff like that.
I didn't like pink for a while. I think I kind of like it now.
Uh-huh.
I think it was just like, I need to be like a boy. I need to do everything that a typical man does. And now I'm more chill because I've transitioned to a point where I feel comfortable in myself. So I'm a little chill about that now.
That makes sense.
Yeah.
And that restaurant conversation you had was it just your mom and dad who were there?
It was just my mom and dad. Yeah.
Okay. And you don't think they had any hint what was going to happen?
I think they thought I was a lesbian. They thought that was what I was going to talk about, but yeah, kind of blindsided them there.
After you told them, what was their first response?
They were like, "Of course I will accept you." And then they didn't really call me by my preferred name at first because we were going on a vacation and we were going to see my grandfather who still doesn't know I'm trans, so they didn't want to mess up in front of him. So that kind of hurt me, but we're all good now.
I can understand that. And when you told your parents, did they try to get you any? Did they get you in any counseling or therapies? What actions happened?
Yes,
next?
I went to my gender therapist, who I'm still with today. I love her; she's the best.
So, how did you find your therapist?
We got recommendations from my pediatrician. And
that was after you told your parents they helped you get some therapy?
Yeah.
And when you started therapy, how did that impact you?
It made me feel a lot better about myself. She is very accepting. She's really cool. She kind of helped me open up. I had a therapist beforehand because I have ADHD. And I really felt like I couldn't talk to her. She just wasn't the right fit for me. But
your therapist beforehand, had you mentioned to that therapist that you were having some of these thoughts about?
No, I did not. I didn't want to come out before I left going to therapy with her because I just felt like she would judge me or something, which is completely like not true. Like, I don't know. I had been with her for so long that I felt like she was like an aunt instead of like a therapist. Like I felt, yeah.
And your new therapist helped you understand your identity. Is that correct?
Yes.
What kind of new insights did you have after you came out? How did life change?
Life got a lot better. It was also a little bit worse because I did get bullied from some of my peers at school.
How did they handle this at school?
As I've said before, all the teachers were extremely accepting, but my peers were less so. I think they just didn't understand it as much.
Did they announce it at your class like they did for the other student, your friend?
No, they didn't. I don't think so. No. I just kind of told everyone, and then I posted something on Instagram, and I was like, "You guys should call me this now."
So it just sort of happened without any kind of formal thing, it sounds like.
Yeah, I did talk to my counselor to tell all my teachers beforehand to call me he, him pronouns and change my name on like the roster and stuff to Tyler.
And the teachers were understanding and accepting, but there was some bullying, right?
Yeah.
What kind of bullying was there?
It was just little things like kids would call me like it. and like misgender me, or like I remember one time I was like running the mile and some kid was uh like basically catcalling me and calling me a girl, and I was like, "Are you serious?" Which was that kind of hurt. It got a lot chiller in high school because people are just cooler now.
Makes sense. Did you ever get hit or?
No, nothing like that. No physical bullying. I
So-
remember one time someone threw like a carrot at me in the lunchroom, but that was about it.
So a lot of name calling.
Yeah.
Did you lose any of your close friends when you announced that you were transgender?
No, not any close friends. A lot of friends of mine kind of drifted away, but I don't know if that's because I'm trans or not.
Did any parents talk to your parents to say, please stay away from my child or anything like that?
No, nothing like that.
Good. 8th grade finished. And during 8th grade, after you started therapy, did you look into more different ways of transitioning?
Yes, I wanted to start testosterone as soon as possible, and I started that my freshman year. So it took about a year to start testosterone, and before that, I was on blockers, hormone blockers.
And you found a primary care who was supportive?
Yes. My doctor, my pediatrician was supportive from the very, very beginning.
How did things change? So the journey for transition is you first socially transitioned.
Yes.
Now we're getting into medically transitioning.
Mm-hmm.
Tell me how medically transitioning is different than socially. How did you feel differently with medically transitioning?
Well, I myself wanted to medically transition. I know a lot of trans people don't want to, and that's perfectly okay. But I was just very dysphoric, and I knew that these things could change if I went on like testosterone and I got top surgery.
For people who don't know what dysphoria is, can you describe it for us, please, and tell us what it is?
It's very hard to describe. It's not feeling like complete in your own body, I guess. It's different for a lot of people. I myself had it very bad before I started testosterone. I wanted to like crawl out of my own skin. I was so uncomfortable with myself and the way that I looked.
And what are blockers?
Hormone blockers are they stop your female hormones. So I started them while I was in the middle of puberty. So they stopped my period, and they stopped my chest from growing more than it already had.
And then did you start feeling less dysphoria once you were on the blockers?
Yes.
Okay. And then testosterone started after the blockers.
Yeah, and I felt so much better after my testosterone started to work. I was on a very low dose at first, so my voice would like naturally kind of like settle, instead of some people who start like when they're adults and they start on a high dose and then they get kind of like a kind of weird voice. Sorry, I don't want to like say weird voice, but different voice. Yeah, different voice.
I understand. And did that feeling of wanting to crawl out of your own skin, did that change with testosterone too?
Yes, a little bit. I still was very dysphoric about my chest, and I don't feel that way anymore. Thank you for that.
I appreciate you saying that. It's my pleasure.
Yeah.
It's really a privilege. And we'll talk about that too.
Mm-hmm.
Tell me what else. So your voice started changing with testosterone. Tell me what else changed in your body.
I gained muscle, a lot of muscle. I gained, my shoulders got wider. My hips kind of got less wide. I was pretty skinny before I started, and my hunger changed. I got a lot hungrier, and yeah, more body hair, stuff like that.
What do you think about people that say that we shouldn't give hormones or let someone decide about medically transitioning until they're 18?
I disagree with that. I don't think you should give it to like very young kids. I think you should give blockers to people who want it. Like, if I had blockers when I was like in 6th grade, I would be in a very different position than now. But yeah, I think blockers you should give to people. Maybe wait a little bit, like at least a year after someone comes out, to like know that this is what they actually want, to give them like testosterone and stuff like that.
I personally do agree with you. I think that makes a lot of sense. I don't think you can put a hard line in the sand that this is
Yeah.
when you make the decision. I think it has to be individual. It has to be custom, and people have to understand what's best and what's safe for them through a process. And that's my personal philosophy on it.
I completely agree.
With testosterone, we had physical changes. You have felt less dysphoria. Did you feel some of the other changes include people feeling more aggressive, things like that?
I didn't feel that. I wouldn't say I was a calm person, but nothing really changed for me. I think I'm more calm now than I was when I started, just because I was like an angsty teen.
And I know you said high school people were cooler.
Yeah.
Tell me, were you getting any bullying in high school?
No, not really. I treat people with kindness now, no matter what. I'm just like, if someone's mean to me, I am nice to them, and then they're like, oh, what do I do now? You know, like, so I don't know. If I'm nice enough to people, they'll stop being mean to me.
That's amazing. Not a lot of people can do that. It takes a special person to really do that. It's amazing. With the with high school, do you feel people did people know in high school that you were transgender, or did they just know Tyler?
So my first year of high school, I didn't really tell anyone, because I just didn't feel comfortable with people knowing. And then my sophomore year, I was also pretty uncomfortable with people knowing, just because of my dysphoria, but now I'm very open about it. I have a bit of a following on TikTok because I talk about like transgender issues and stuff.
That's cool. How many followers do you have?
Oh, I only have like 3.8K, but yeah.
That's a lot. That's awesome. Do you think people just knowing Tyler and not knowing your past identity made an impact in high school?
I think I liked that. But also I could hear like people talk very badly about like women in front of me. They were like very misogynistic because they thought I was a cis man, and I was like this isn't cool. But I didn't say anything because I didn't want to risk people knowing, and I wish I did say something now.
Were there other people who were gender non-conforming in your high school?
Yes, I don't really have them as friends because they were all in like older years. I have one friend who's pretty cool. He's transgender. I've known him since middle school. Not the friend that I was talking about before, but he's really cool. He got top surgery at like 15, 14. He was the youngest person in our state to get approved by insurance, which was really cool.
Wow.
Yeah.
In high school, what made you want to tell people that you were transgender?
I think I just started to feel more comfortable in my own body.
Why did you want to tell people at all? Why not just keep staying as the cis identity that you have?
I didn't like the way people would talk about like transgender people in front of me. They were like blatantly homophobic and transphobic, and I didn't say anything because I didn't want to risk like them knowing, because I saw what they would talk about, but I was tired of them talking about it in front of me.
How did people in high school start learning about this?
Well, I think an LGBT speaker came into our high school a couple of years ago. I'm not quite sure. But people on TikTok, people on like YouTube.
So you let social media be your pathway.
Yeah,
there was no formal announcement or anything like that.
Yeah.
Did people change how they acted around you?
They did, yes.
Tell me how.
Well, I'm in online school right now, but on Instagram and stuff, people were like, "Oh, cool, good for you," instead of like, yeah. The same people who were like blatantly homophobic and transphobic in front of me were commenting like, "Cool."
No way.
Yeah. They don't want to do it in front of other people who like, they don't want to get called out.
Did you do anything different around people once they knew? Did you try to be more active, or you just let the identity be out there?
Well, I'm in online school right now, so I can't really be active because nobody's talking about that.
Yeah.
Yeah.
Makes sense. So you started letting people know once there was online school, not once there was in-person school.
Yeah.
Makes sense. Did you lose any contacts that were staying in touch with you at all, or not really?
Not really. I have a very I have like 2 friends and I'm perfectly fine with that. I need to really connect with someone to be their friend.
Yeah. And did these friends know earlier on in high school that you were transgender?
Yes, yeah.
So then you're medically transitioning, you socially transition. Now you're starting to think about surgery. Is that right?
Yes.
How old were you then?
Oh, I've wanted surgery like since the beginning, since I've like talked to since I talked to my therapist like the first day. I was like, I need you to help me get top surgery. Like I need it.
As you were getting older, what made you finally want to decide that you want to pursue it?
Well, I was old enough eventually to like actually get it. My insurance covers it 14 and up. Thankfully, my insurance is really good with that kind of stuff. And I was like, I really need this. Like, I really need this. I was binding unsafely for like 23 hours in a day. I would only take it off to shower and I would like wear it to bed. And I had some problems with my ribs eventually because of that.
How did you ask your parents, or did they know about it?
I talked to my parents about it a lot. They said they would do it, and then they would go like months without doing anything, and then I would talk to them about it again, and they were like, "Okay, cool." So I had to really step in and do a lot of the stuff.
Did some of your family members want you to wait till you were 18, or?
No, I don't think so. No.
What did you start doing to get the ball rolling on surgery?
Well, I looked up a lot of surgeons. I looked up you because I went on this site called TransBucket that had a lot of results, and I really liked yours in particular. They were only like 3 results for you on TransBucket. So I looked up like if you had an Instagram, and you did, and I looked through your stuff, and I was like, wow, this is really good. Like the scars look really good, and I was like, at first I had another surgeon, but he lived in Oregon. He worked in Oregon, and he had like a year-long wait list, and I was like, okay, I can't do this. So, yeah. I also talked to my therapist about you.
And your therapist, had they heard of me?
Yes, yeah.
Okay. And then you, what else did you do? Did you call the insurance company yourself? Were your parents helping? What was happening?
I sat down with my mom and I was like, can you please call the insurance company? She was like, cool. Yeah. And then, yeah.
And then you got approval to come see me for the consult or something like that, correct?
Yes.
And what made you want to finally decide? Was it the results? Was it the social media presence that I have? What helped you decide that you wanted to come to me?
Oh, sorry. Like everything. Like I really liked that you were very open about it on social media. I really liked seeing you do the surgeries. I just think it's like really cool how you can like just do that. I just find it really interesting.
Sure. Were you watching on Snapchat?
Yes.
Oh, that's awesome. Yeah.
I downloaded Snapchat just for you.
Oh, thank you. Did it gross you out at all or not really?
No, I don't find it gross. I find it really interesting.
That's so cool. And then you came for the consult. Tell me how that went. Were you nervous before?
Yes, I was extremely nervous.
Why were you nervous?
At the time, I really wanted periareolar. And I ended up not getting that because I couldn't. And I was really nervous that I couldn't. But your scar results were really good anyways, that I was like, I still want to stick with you. So
for top surgery, there's 3 options typically. There's different variations, but one, the most common I would say, is double incision.
Yep.
That's where you make a cut across the chest. You remove the nipple. It's called a free nipple graft. Not free as in it's free, but free as in it's removed and reattached. You remove a lot of tissue. There's a scar across your chest, sometimes connecting in the midline, sometimes not. And then you put it all back together. And that's the most common. The other kind, and that's most common because people often have a lot of skin and tissue. And if someone has a lot of skin and tissue, you have to remove it, in my opinion. Otherwise, you don't get good results. And you've seen how bad those look online.
Yeah.
So most common, that's the operation. Second most common that I do is called a keyhole or periareolar. That's where you just make an incision on the bottom half of the areola, sometimes all the way, depending on how you're doing it. And you go in, and all you do is remove gland.
I find that one like really interesting because it's like you pull so much out of such a small hole.
Yes,
like, how does that happen?
Yeah, I did one on Friday. I don't know if you watched it.
Yeah, I did.
Yeah. So then you just remove the tissue, and then you let the skin contract or shrink around. Now that works well if there's not too much extra skin. If there is a lot of extra skin and you do that operation, you're going to be botched. You're going to get lumps, bumps, divots, and irregularities. No one wants that. The other more common operation is what's called an anchor or inverted T. That's basically a cis female breast reduction done with the T scars, and you remove it. Now that operation can work. The challenge with that is oftentimes you have to leave a good amount of tissue behind because the skin and the around the nipple and the nipple itself has to live from a pedicle. And you have to leave enough tissue for that pedicle to be alive. And if you leave too much, it doesn't look right.
Yeah, so, I've seen results from that one, and that was not really what I wanted.
I agree. It's not. It's the least common one I do. And so we met and we came for the consult. Did you have any other worries about anything else other than the surgery you wanted?
I don't know. I was very anxious about like, I don't know, taking off my shirt in front of you and stuff, but you were very like chill about it. Like you were very respectful, which I really appreciated. You're very respectful in your consult.
Oh, thank you.
Yeah.
Tell me how the consult went.
It was really good. I was a bit disappointed that I couldn't get Perry, but other than that, it was really good.
Awesome. And then you went home. You talk about it with your family?
Yes.
What did you guys talk about?
I was just really excited to get it, honestly.
And then you booked surgery, and then surgery day was coming. How were you feeling the night before?
I was so excited. I barely slept at all.
That's so cool.
I was also a little bit hungry.
The day of, right?
Yeah.
Yes. And we don't have people eat before surgery, at least 8 hours before, because you don't want to vomit and things like that, right?
Mm-hmm.
You can aspirate or choke. So then we had surgery day. We did the operation for you. We can't Snapchat people less than 18 years old, obviously, so we couldn't do that. And then the operation went, I would say it was a wild success. We were able to create a form and physique. You're still, what day was surgery? Tell people, please.
September 2nd.
So just a few weeks ago.
Yeah.
Right? And the surgery went, and then you were in recovery.
Mm-hmm.
Were you having a lot of pain?
It was less than I expected, like significantly less. It was still a little bit of pain for the first few days. And then it was just sore afterwards. I remember a couple days after my surgery, I started getting like a really sharp pain in my left side that wouldn't go away for a little bit, and none of the painkillers helped with it. And that lasted for a couple of minutes at a time. But other than that, it was perfectly fine.
Right after having the surgery, were you having any different feelings of dysphoria?
No, not really. I felt like really bloated, which kind of made me feel gross because my hips were like wider than they usually were and my stomach was like out. But other than that, I was really good. I was just really, really happy.
That's awesome. When you came for your post-op and you saw your chest for the first time, how did that feel?
It felt unreal. It was crazy. It also looked a little bit gross because of all the like scars and stuff, but it was cool. I wasn't bruised at all. I was expecting to be really bruised, but yeah, I looked really nice.
How have things been since then, Tyler?
I've healed pretty well. I am not in pain anymore. I can't really feel. I'm kind of numb, like right underneath my scars, and I can't put my arms all the way up yet. But other than that, I'm really good. I feel perfectly fine now.
That's great. How's your dysphoria?
I feel so much better.
What feels better?
I just feel like a weight has been lifted off my chest, literally and physically. I mean, wait, literally and what's the word? Metaphorically, yes.
Are there different things you think you'll be able to do now that you weren't before?
Yes,
surgery?
I want to like get into working out and like running. I couldn't do that in a binder, and I didn't feel comfortable enough to do it without one.
You know, Tyler, we didn't tell people what it means to bind. Tell me what that is.
So you use a chest binder to make your chest look smaller, and it kind of restricts your breathing and stuff like that. So it has a lot of cons, but it made me feel better about myself. So,
and binding can be really painful, number one, and it can really cause deformities.
Yeah.
So as you know, right, when you bind, you're wrapping your chest. And what can that do? It can pull the breast skin and tissue down, stretching it out, causing it to fall lower. It can cause compression on your ribs, causing potentially deformities of the chest wall if you're doing it extremely tightly, continuously. And it can limit your activities as far as exercise and breathing. And you were having some of those symptoms, right?
Yes. I did use tape for exercise, but I ripped my skin off when I took it off. It was a tape made specifically for trans people to like tape their chest. I still used it. I was just more careful with it. But yeah, the tape, it let me breathe. The only thing was the like ripping off my skin. which was not fun.
What other activities are you going to be more comfortable doing now than before
Um,
surgery?
Choir is a lot easier. I'm a choir kid in my school, and I can actually take like a full breath in now,
Mm-hmm.
and my posture is better. Just like a lot of things are better.
Do you feel more comfortable in your identity?
Yes, I do.
Sometimes, Tyler, people think about other surgeries on top surgery. Is there anything else that you want or have thought of?
Maybe in the future I might want to get phalloplasty, but right now I'm fine with how I am.
What's new? What's next for you in life, Tyler? Tell me what you want to do when you grow up?
I have no clue, honestly. I don't know. I wanted to be a streamer for a little while, but that isn't working out. So
Why isn't that working out?
I only got like 53 followers.
It takes time. It takes time to build a following. Do you want to go to college?
I'm not sure yet. I don't really know.
How has high school been right now? Online, because it's very different.
Online is very stressful. I feel like I have ADHD, so I need like a schedule to complete things. Like I really need that. And with online school, it's a lot harder to do that. So I fall behind a lot easier than most students.
Did you think it was better to be in person?
Yes, but I was also very thankful it was online because I had my surgery the second day of school. So I was able to go back to school earlier than I would have if it was in person.
A lot of people say that, in this post-COVID, in the COVID world, pandemic world that we're living in right now, that people are more isolated. They don't connect as much. I know you're an introvert.
Yes.
Naturally. Now, are you feeling that at all?
A little bit, yes. I don't get to see my friend as often. She lives in Woodinville. She's my best friend. We've been friends since like elementary school. I kind of miss her. I don't get to see her as often. She lives in Woodinville, and I live in Redmond.
Sure. How did your friends know you were having surgery?
Yes.
How have they been through this journey?
I think they're getting tired of me talking about it. I talk about it a lot.
And what do you say when you talk about it?
I'm just like, bro, my chest looks so good. I was like amazed that like when I put my arms up, I could see like the muscles moving underneath. I've never seen that before. And I was like, whoa.
That's awesome.
Yeah.
I'm so happy. Doing gender affirming surgery is one of the biggest privileges I have. I get amazing people like you, Tyler, who come to me. And not only am I able to do something that I feel I'm amazing at, but I'm able to really help them get a different life,
Yes.
And that really drives me and excites me to do it. And that's why I do what I do. I love impacting people. I love changing lives. I love helping people get to where they want to be, wherever that is, right? For me, a lot of people ask me my opinions on different things. I always tell them my opinion is irrelevant. What matters to me is how I can help my patient, how I can help them get where they want to get, and how I can help them be who they really want to be. And that's what it's all about for me, Tyler. We're so thankful. We have so many fans who watch what we do, who hear our podcasts, and oftentimes they want some level of insight from you. So let's say this is you listening when you're in 6th or 8th grade, and you're having these thoughts about transgender or being gender non-conforming, and you're sort of figuring out what to do, and you run across this YouTube video or this podcast or IG post, and you're looking for some advice.
Okay.
What would you want to share?
I really wish, first of all, I gave my parents time to like understand things instead of getting really angry at them when they didn't call me like my preferred name and stuff like that. Like they need time to understand. Like this is a big deal for them. Even if you've known for a very long time, they haven't. So give your parents time. They still love you. They respect you. They're just trying to figure things out. Also, I know it might suck, but please wait off just a little bit to know if like you really like, after you socially transition, wait like a year to find out if you really like this, and then go on like testosterone and stuff.
That's so thoughtful. Sometimes I see that a lot in my clinic, Tyler, where I'll have minors who are undergoing the process, and I'll literally see them yell at their parents for making a mistake on name or pronoun. And I can see it in the pain in the parent's face and in the child's face. It's a struggle for everybody, and it's so hard. But I think you are very special in that, you said something that was so thought-provoking that people are mean to me, I'm nice to them. And I think you understand more than most, and you connect with more than most people.
Yeah, to a fault sometimes. Yeah. I forgive people too easily, stuff like that. But I wish I was nicer to my parents when this happened, because it's a big deal for them and it's a big deal for you. And I know how much it hurts to be misgendered, especially by someone you love, but they are trying. They're trying to understand and they're trying to accept you.
Have you told your parents this?
No, I don't think so. Sorry, Dad.
That's amazing. You're an amazing person, Tyler.
Thank you.
Thank you so much for being our guest today, Tyler. I learned so much from you. You gave me so much insight, and I know our viewers are going to learn a lot and take a lot away. Your journey is one that's truly extraordinary, thought-provoking, and touching. I know your ordeal will teach our listeners how and what to expect as they start their own journeys. I appreciate your time and an honor to have you as my good patient and someone I've truly connected with. Thanks for listening to the Plastic Surgeon Podcast, and please rate and review us on Apple Podcasts to hear more amazing content. For my live surgeries on Snapchat and my adventures throughout the week, catch us on all social media at realdrseattle. See you next time. Bam, what?